Good evening, everybody. I'd like to call to order the CMH full board meeting for December 18th, 2024. Please stand for the pledge. Next will be the reading of the mission statement from Selena.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next item is adoption of the agenda. I'll take a motion to adopt. Motion from Dana, support from Lori. Are there any questions or changes on the agenda? Hearing and seeing none, all in favor say aye. Aye. All opposed? Agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Give us your name. And you can talk about whatever you feel like, Bruce and Angel.
Good evening, everybody. Bruce Dutton, Director of Crossroads Clubhouse in Warren, Michigan.
And I'm Angel Weiss, member of Crossroads Clubhouse in Warren, Michigan.
I think as most of you know, as part of the contract with the Michigan Department of Health and Human Services, clubhouses in Michigan have to go through the accreditation process. Just in December 3rd, 4th, and 5th, Crossroads went through their accreditation process, and we wanted to talk a little bit about some of those experiences and the outcomes of that.
This was my second accreditation that I was involved with, and I was really involved with a lot of it. I sat with Tracy and your supervisor, Libby. And I sat with both of the chairpersons for our foundation and our advisory board. I sat in on that, and I answered a lot of questions from the two faculty that came to visit us. It was a really enlightening experience for me. I got to see our clubhouse through somebody else's eyes because, of course, I see no wrong in our clubhouse. We're perfect. But they have different glasses on than I do. And so talking to them, I got a eye awakening on a couple things. And I was really grateful for Tracy and Libby and the chairpersons of our boards that came out. And they interviewed those people, and they spent 3 days working with us side by side. And they got to know a little bit about our clubhouse.
So one of the great things about the clubhouse and the clubhouse model is that there's 37 standards, and some of those standards have substandards. So when you go through the accreditation process, you're really trying to highlight all of those things that your clubhouse does that shows that you're at least meeting the spirit of those standards. We got one recommendation out of all of those 37 standards and all of those substandards. The really, really cool thing about this is we got a recommendation on something that we're doing that we shouldn't do. So that's important to know, because when you get a recommendation because you're not doing something, that's a hard fix. But to eliminate something that you're doing that you shouldn't be doing, that's an easy fix. So I just wanted to say I'm really, really proud of Crossroads Clubhouse and the community and the unit leaders and how well they did, and the membership, because they really showed our faculty why we constantly say that Crossroads Clubhouse in Warren, Michigan is as good as any clubhouse in the entire United States. And I'm very, very proud of that. And I just wanted to share that outcome with you tonight. And so thank you for that.
And just in case you don't know, a recommendation is something you have to fix. It's not, oh, well, you can fix it if you want to. That's something we have to fix. A suggestion is, well, we'd really like you to try this, or we'd really like you to try that. And only have one recommendation, one thing to have to fix is just amazing. I'm so happy.
Thank you.
Thank you both. Anybody else wishing to speak? Anybody else wishing to address this board? All right, we will close the first hearing of the public. There is one more before we close the meeting. And I'll move on to item 5. I'll take a motion to approve the minutes of the CMH full board meeting held on Tuesday, November 26, 2024. Motion from Megan, support from Mark. Any corrections or changes to these minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes with Nick abstaining. I guess I probably should too. And Dana abstaining. Although they look good to me. Abstention with comment. All right, thank you. That minutes are adopted. We'll move on to item 6, which there are no minutes to approve from program and budget, as we did not have one this month. And we will move on to item 7, request to approve. I will take a motion to approve items A, B, and C, which are residential leases. Motion from Dana, support from Megan. TJ, go ahead.
All 3 of these leases are the same landlord. There is or was a litany of repairs to be made. Nick had asked me about one of the issues prior, and I can assure you, Nick, that it has been taken care of.
Any questions for TJ? Okay, hearing and seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we'll move on to item 7D. Take a motion to approve additional workstations for CMH admin for a cost of $52,988.30. Motion from Dana, support from Lori. TJ?
Office furniture is very expensive, as you could tell. MCO has requested 7 additional workspaces for their employees, and while we're ordering those 7, we'd like to order an additional 4 touchdown spaces at admin. I shouldn't say touchdown spaces; they're full workstations. They're a bit smaller. We're going to take out some of the collaborative furniture, and we're going to repurpose that in some of our lobbies. And then we're ordering additional chairs. We have some chairs in our, all the chairs at Children's, North, and most of West have been replaced, but there are now a handful that we need to replace as well. So that's the workstations, and the 7 workstations, 4 workstations, and the 15 chairs.
Great, thank you, TJ. Any questions or comments for TJ? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next is item F. Take a motion to approve immediate termination of the contract. Oh, I'm sorry, I missed E. I'll take a motion to approve expenses not to exceed $55,000 for updates to the north lobby. Motion to approve? Motion from Megan, support from Selena. Sorry, TJ, go ahead.
That's okay. As you could see, the workspace in the lobby, we want to expand. There's 4 clerical folks that work there now, and it's a bit of a tight fit. So we're going to bump that out slightly. The lobby size will decrease, which really will not affect the amount of clients that we see in the lobby. At the same time, we've already purchased furniture for the lobby. And we're going to, while we're having this done, we're going to make some upgrades to ADA accessibility at the counter level. We're going to make it much more accessible. We're going to redo the flooring. We seem to have a lot of problems with the flooring there. There's folks that have all sorts of issues, and that shows up. So we're replacing the flooring there. And there is some safety that we're taking care of at North, and that will be incorporated into this new lobby as well, so.
Thank you, TJ. Any questions? Okay, seeing none, all in favor say aye. Aye. All opposed? Motion passes.
Thank you.
Now, thank you, TJ. Next, we'll move on to item F. I'll take a motion to approve immediate termination of the contract between MCCMH and Oakland Physicians Center, DBA Pontiac General Hospital upon notice. Motion from Selena, support from Lori. Go ahead, Christina.
This is coming to you because they do not have current accreditation, which is a contractual requirement, and they also have chosen to file for bankruptcy on their own accord, which is also in violation of their contract. We did have one individual serve there. He would be returning back to his home as soon as he is medically able to do that, and then we have no other individuals there.
Thank you, Christina. Nick?
Christina, you said there's only one patient, he's going home. Is he ready to go home?
I don't know that as of today, so I wouldn't want to say that without speaking to his case manager, but the home has confirmed that he will be able to return there
Oh, okay.
once he's able to.
It's not a private residence.
Correct.
We obviously have to do this. I'm not questioning need. I mean, it's a real serious problem, but it exacerbates an existing problem, which is a shortage of beds generally in the hospital setting. Is there any activity that we should be doing or could be doing to help deal with that other than just trying to?
Just kind of waiting. Well, I can tell you that they are working to correct things so that they would be in a position to recontract. We have other hospitals in the area that have expanded. It wasn't one to be open that we used widely. You know, it's not in Macomb County, so it's not as if it's one that's, you know, our main source for inpatient beds. And we'll stay in communication with them to see, you know, if they are able to come into compliance and if we feel that that would be a safe area to contract with and send individuals served. But I think the other hospitals in the area are compensating for us.
And can I just add, I did have the privilege of going to the Beaumont's new location, opening in West Bloomfield, and they are going to have more beds at that new location. That's not until, I believe, mid to end of January. So we're optimistic that will help counterbalance, not perfectly, and I know that there's diligent efforts throughout. Oh, my bad, I'm so sorry. Henry Ford, I should give proper credit. I went to the ribbon cutting, it was beautiful, it's a beautiful facility for Henry Ford. To be fair, as you know, their names changed, yeah. They're doing some great stuff. I would definitely attest that. It looks like a great, not just physical location, but their kind of philosophy, and they explain kind of how they're gonna do it, so we're very excited, and I welcome Selena if you wanna add anything, but I think that will help in a small capacity.
Part of the problem is the lack of state
Yes.
beds, which we've been advocating on for some time. I suspect part of this problem is also some actions that may or may, I'm guessing, you can correct me if I'm wrong, by the Certificate of Need Committee, which tries to keep the number of beds down to a reasonable number for cost purposes. Do you have any indication that maybe they overdid it, particularly on psych beds, maybe?
Maybe, but to be fair, it's a very complex problem. So what I mean by complex is, and Selena, you're welcome to jump in, but there's bottlenecks. So I get into the hospital and then I have nowhere to go. Well, if I don't leave, then the bed is filled and there's not another opportunity. So I don't think it's this one, what you're suggesting might be part of the dilemma, but I don't think that's the only dilemma. And then we go to, there's not enough funding to fund the system of care is a major problem, both for the hospitals and for us.
Any other comments, questions? Okay, all in favor say aye. Aye. All opposed? Motion passes. Next, we'll move on to item 7G. I'll take a motion to approve contracting with Bromberg and Associates LLC for interpreter services for fiscal year 26 and fiscal year 27. Motion from Megan, support from Dana. Christina, you want to talk about this one?
This is a recommendation as an outcome of a request for proposal that we did this year. We had not procured the service in a while. It was just a good time to do that. They were the highest scoring bid. It does happen to be our current vendor for this service. So we think that this would be the best recommendation to the board.
Thank you. Donna?
See if I can get this to work. I just wondered if they were the lowest bidder or not out of the four.
Financially or?
Yeah,
rates?
financially.
They were comparable. They were not the lowest financially, but they were the service that they were going to offer compared to others that may have had a lower amount with what they would do and the languages that they could provide and the technology they could provide. This was the best provider for the fit.
Yeah, I just wondered why they were chosen, if they were chosen because they were the current provider or
Nope.
what the reason was out of the
Yep, we
four.
always look at what they can offer for those that we serve. The languages are really important for this and the different types of technology, face-to-face, doing telephonic, the availability. If they are local, if they're not local, we had some that bid that were not local at all. So they're never going to offer a face-to-face component, which is really critical for our population. So we wouldn't want to look at just who's the current, we would want to look at who's the best fit. And we do scoring, so it's broken down by different scales of scores to look at the scope of service and the financials and the organization overall. And then that score comes together with all the procurement committees and look at, overall who is really the best fit.
Okay, thank you.
Yeah.
Thank you, Donna. Any other questions, comments? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next, I will take a motion to approve contracting with Lifeline for Personal Emergency Response System, PERS services for persons served. Motion from Lori, support from Donna. Go ahead, Christina.
This one's coming to you because this was a combination under the Henry Ford contract. Henry Ford and Lifeline are parting ways in that contractual relationship. And in order to sustain the care of those individuals that they're currently serving, we want to enter into a contract with them so that the people can continue with that same service and the same system that they're used to. It's still medically appropriate, still, under the PHP CPT code chart that we can build this code out. And so we just want to look at no change in care for those folks.
Thank you. Any comments or questions? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Thanks, Christina. Next is item I. Take a motion to approve contracting with 3 CCBHCs in Macomb. Motion from Selena, support from Megan. Okay, I am in the right spot, right? Okay. Tracy, go ahead.
So this is just asking us to negotiate with the three different organizations listed, Judson Center, CNS, and Easter Seals. So that's all the request is. But I'm happy to answer any questions if you have any.
Sorry, Selena, go ahead.
Okay. Can you explain a little bit more about what you mean we're contracting with them? Or are they contracting with us to help provide the services that they can't do now that they got their CCBHC?
This is only a request to further explore both of those opportunities. That's all this is. It's part of our normal
Okay.
ask. It's, we would come back to you with any additional details.
So this is an exploratory function we're granting to you to
Yes.
move forward, but no decision has been made on anything.
Correct, on the details.
Okay, that's all I needed to know.
Thank you, Selena. Any other comments or questions? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next, we'll move on to item J. I'll take a motion to approve contracting with Advanced Therapeutic Solutions LLC effective December 1st, 2024 through September 30th, 2025. This will be for music, art, recreation, and massage therapy services. Motion from Donna, support from Dana. Christina?
This was also an outcome of a request for proposal that we did this year as a need, as the demand for these services has increased. We did only have one bidder submit in response, but even with that, their score still did meet all of the requirements, and we do feel that they would be a strong recommendation for board approval to contract with.
Thank you. Any questions or comments? We had to slip that other one in there to give you a little break.
Yeah, thanks.
Between items. Sorry about that. Seeing no comments or questions, all in favor say aye. Aye. All opposed? Motion passes. Thank you, Christina. Next is item K. I'll take a motion to approve the use of the MDHHS grant funds to sustain and expand MCCMH's evidence-based programs. Motion from Donna, support from Megan. Agnes, go ahead.
Good evening. So this is just grant funds, using our grant funds to bring a number of evidence-based practices. We've had some of these before, but as you know, we do have new clinicians constantly coming in, clinicians who need refreshers. So you can see here, there's a number of evidence-based practices that we are hoping to fund with those grants, with that grant adult block grant funds.
Thank you, Agnes. Any questions or comments? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next, we'll move on to item L. I'll take a motion to approve the MDHHS amended grants for fiscal year 25 integrated care. Motion from Dana, support from Lori. Agnes, go ahead.
This is just making some revisions to kind of already what you've approved, just allotments and money. For example, like the drop-in center, we allocated some money for bus tickets that was needed, also for computer monitors, for Liberties. So things that we were asked that some of the providers needed for integrated healthcare grant. These are just different therapies. For example, this coming year, we're bringing in equine assisted therapy. So we're going to have a therapy ranch that will do some non-horseback riding activities, so ground therapy with our kids and adults. So just some reallocation of funds for things that our providers have requested for the needs of our kids and adults.
Thanks, Agnes. Any comments or questions? Aside from a lot of nods and smiles for this one. All in favor say aye. Aye. All opposed? Motion passes.
Thank you.
Thanks, Agnes. Next, we'll move on to item 8, which are 2 receive and file items. I'll take a motion to receive and file fiscal year 2024 Quality Assessment Performance Improvement Program Work Plan. Motion from Selena, support from Donna. Tema's here with a special guest. Go ahead, Tema.
Special guest. Good evening, everyone. And just as a reminder, this board is responsible for the Quality Assessment Improvement Program, which is actually sent to the state of Michigan for approval. So from time to time, you'll see me here to provide updates and initiatives that we are taking to make sure that this program is successful. So today, Matt and myself, we are going to present some updates on incident reporting, access to care, which is also part of our strategic plan, and we are also going to talk about member satisfaction survey. So the first page that you're going to see is events data review. I just wanted to start from the end. For fiscal year 2024, we received 5,448 incident reports. These are any kind of incidents that happens with our members, either in their homes, in group homes, wherever they are. We receive all of these incidents, we classify them, we put them in various categories. So we have critical incidents, events data for risk, all the events that are risk, sentinel events, and immediately reportable events. All of these events are also sent to the state. And for those that do not meet this category, we classify them as other, which means they are not as severe. What also happens is if it's a sentinel event, we also request for a root cause analysis to identify where the issues were and how to mitigate them in the future. In addition to that, we are looking at systemic remediations. If we find out that some events are happening consistently in a specific home or by a specific provider, we also request for remediation on that. Some of the challenges that we have faced this year with this data, providers are not reporting timely. So sometimes we find out that an event occurred when something else is happening. Let's say a staff goes on and goes to the site and they find out, then they're asking, where's the incident report? It was never sent to us. So we have been consistently reminding providers to make sure they send them to us within 24 hours. Other times, the forms that they use is inaccurate, or they don't complete the form accurately. So we have to reach back to them every time to say, can you complete the form? Can you send this and that? So that's also very time consuming for the staff who is doing this work. So the next piece I'll move on to is our access to care data. If there are no questions for events data. Access to care is part of our strategic plan and is also in our improvement project. The first draft that you see is for pre-admission screening. This is for us to be able to make a determination within 3 hours of a request. As you can see, we have consistently been above the benchmark. The benchmark here is 95%. Even though we are kind of sloping downwards, but it's very, very minor. I have to say I have not done justice to us with this data because it looks like it's so wide, but it's really like less than 1%. So we don't have to worry much about it. However, we have identified what could be the issue, and we are actively working to start going back up. So that is the plan. The second one, the second access to care is requests for timely requests for service. So if a member requests service, they have to receive this service within 14 days. We are very proud to say that we have consistently been doing well. We are not exactly where we want to be. We are right about the benchmark, but I have only presented up to Q3 data today because we are still making some analysis to correct some issues that we are finding with this data for Q4. But once we get the final report, it's going to look much better than you see today. But I also wanted to point out most of the reasons why we are getting out of compliance for this is because the members are not fully engaging, and they have been reversed from what it used to be in the past. We have to engage our members because even if the member decides not to show up, it still counts as an exception for us. So that's why we are so low, but we are working very diligently to get our members engaged and to show up to these appointments. The next one I'd like to touch on briefly is follow-up after hospitalization. When our member gets discharged from the hospital, the expectation is that we see them within 7 days of discharge. So right now, we have been struggling a little bit, and the bigger challenge in this space is availability. When we receive this data, we reach out to our providers and ask them, can you tell me why you are out of compliance? Can you tell me why you were not able to see this member within 7 days? Most of the times they tell us, we don't have the psychiatrists, we don't have staff to see them. So we are also working with them, and I know Tracy and Helen has been working diligently with these providers to find out how they can support them so they can be more successful in this KPI. That's all I have for access to care. And I'll let Matt talk about member satisfaction survey.
Thanks, Emma. This year for 2024, we completed the membership satisfaction survey as we have done for years past. We did see a sizable increase in the amount of participation for adults, an increase of 153 cases compared to the year before. There was a minor decrease in the amount of participation for children and family of 9, although it's not something I believe to be an area of significant concern. This could be within just the statistical margin. One of the reasons that I feel as if we had some changes in the amount of participation was we increased our outreach efforts to providers. Namely, we offered the ability to pick up the surveys and drop off survey materials in person each week and at any point in time where they requested additional materials. We had a number of email outreach efforts as well. After every one of those outreach efforts, we did see an increase in the amount of participation. So the changes that we made in the means of outreaching to some of the other providers seemed to increase the amount of participation, which was good to see. The survey was completed within 7 weeks in September and October, which are fewer weeks than they have been completed in the past. So despite spending fewer time or less time on the survey itself, we saw an increase in participation. For slide 9, as you're looking at it, those are some more of the detailed demographic information. There are no significant deviations amongst all of those compared to the years past, which is what we would expect. There's no broader changes in the population within Macomb County, so we wouldn't expect those to change much. In slide 10, for the overall satisfaction rates, we saw a really healthy increase in the amount of satisfaction amongst all the domains that we measured for the adults. That was 7 broader domains, including general satisfaction, access to care, quality of appropriateness, participation in treatment planning, outcomes, functioning, and social connectedness. For children and family, we didn't see significant changes aside from 2 of the domains. There was a slight increase in general satisfaction and a very small decrease in the feeling of social connectedness for children and family. Because the changes in the demographics were in the amount of surveys for adults, much of that was because of the directs. So we saw a lot of VTPS increase the amount of cases, and a lot of the areas that we measured for the directs were really strong compared to the network average. So in other words, they seem to have really strong outcomes. So because we had more participation for the adults, we suspect that one of the reasons why we had broader increase in the domain is because of the direct participation in those surveys. And in slide 10, for the significant trends, there were 3 really common trends we saw amongst individuals that report dissatisfaction with services. The most common trend was if they report dissatisfaction with services overall, they also strongly felt as if the psychiatrist's availability was too limited to give them the care that they required. So in other words, if they had a medication change and they wanted to see the psychiatrist within that same month because they felt as if the change wasn't adequate, they reported that they weren't able to do that. So it could take 2 or 3 months before they're able to see the psychiatrist for an adequate period of time. There are a few mentions of not spending enough time with the psychiatrist during those sessions as well. We commonly offer 30 minutes amongst most of the providers. Many of the members still felt as if that wasn't enough time. One of the other trends that we noted was that the dissatisfaction rates that had been reported were also associated with not having enough information about side effects from medications. So if an individual started a new medication, they didn't feel as if they were adequately informed of side effects by the psychiatrist or case managers that saw them after those appointments. And then the last trend the most frequently reported personalized complaints was a desire to see the psychiatrist more often, and then high staff turnover. That wasn't unique to any one position. They felt as if case managers and CLS staff and therapists the turnover was especially high. And it made it really difficult for a lot of members to feel really adequately cared for in treatment, particularly when they felt as if they had to report same incidences that have already been reported to other providers in the past. For example, if they had to report trauma once again, which is a really difficult thing and not part of the best practices that we would typically espouse. And then slide 12, there are some impact statements there. The very last one, I felt like it's probably important to read. It's one of the most impactful ones. This is about Liz, one of the case managers that we have at North. And it states, Liz, my caseworker, is so helpful. I was recently homeless and at the same time lost my therapist. My therapist was with me through a lot of very bad times in my life. I thought about suicide a lot. When I was homeless, my thinking went down again. Liz pulled me out from that. Liz helped me with paperwork, remembering appointments, getting me early appointments, talking to me. She never made me feel like things were my fault. She still told me I could do things to help myself, though. I really don't know where I would be without her. She gets a 10 out of 10. I wanted to highlight that one in particular because of the efforts that are made by the staff that are there, and also because it highlights, once again, that staff turnover was an issue for that individual and that they were losing their therapist. I welcome any questions.
Thank you both. Great report. Very appreciated. Nick has a question. Go ahead, Nick.
You kind of addressed it, but it's kind of hard to hear in this room sometimes. Maybe you could help me a little bit. The access to care pre-admission screening, 3 hours, there's a huge drop from what was already a very bad. Supposed to be at 50%. Oh, I'm sorry. No, I take it back. Never mind. Misreading the chart.
All set? Okay. Any other? Megan, go ahead.
Just Just a quick comment. I am not a numbers guy, so when, like, the idea of looking at analytics and numbers, it just kills me, the thought of it. I appreciate so much the way that you did this and so much the way that you put in the statements. Like that, for somebody who's like, it's so nice to see something tangible, so thank you for that. Just wanted to, good job.
Yeah.
Thanks, Megan.
Thank you.
Any other questions or comments for them? No? Okay, thank you both.
Thank you.
Thank you.
We have a motion to receive and file the report. All in favor, say aye. Aye. All opposed? Motion passes. Next, I'll take a motion to receive and file the letter of resignation from Ryan Fantuzzi, effective December 10th, 2024.
We can't let him go.
It's too late.
I know. So moved,
Motion from Megan, support from
begrudgingly.
Lori. Just to let board members know, Ryan's term does end in March in a few months. So instead of interviewing somebody next month, appointing them in February, I just felt it made sense to do it all when they come up again. So we will have a vacancy here for just a couple months. So if anybody has a problem with that, you can vent to me about it. Seeing no other comments, we will also have a resolution for him closer to the end of the term. So any other comments or questions? Okay, hearing and seeing none. All in favor, say aye. Aye. All opposed? Motion passes. Next item is resolutions. We have none this month. And next is take a motion to pay the bills. Motion from Selena, support from Lori. Comments, questions on the bills? Okay, hearing and seeing none. All in favor, say aye. Aye. All opposed? Bills are paid. Next, we will have the CFO update. Ken and Tony. Go ahead, guys.
Good evening. We, as we have in the past, are not presenting October financials, which would be the normal cadence. If we went on a month-by-month basis, those numbers tend to be unreliable and not particularly useful. So what we wanted to do, we've put together this document that you should have, the finance year in review. We called it that. It actually, some of it goes back to prior years, but give you an idea of some of the things that we're doing in finance as opposed to the monthly routine with the financials and some of that kind of stuff. There's a fair amount of detail here. I think we're gonna hit the highlights as we go. But you know, you have it if you'd like to read it. So the first one there that I think this section is important and we're spending a little bit more time on is the fiscal 24 results. Tony presented our September numbers last month at the normal meeting. Since then, we have obtained our actuary ISF report to support our ISF balance for both 24 and 25. So the 24 report shows that we could put in up to just over $58 million. So that we expect that to be fully funded at the end of 24. Our Medicaid savings being fully funded as well at approximately $20 million. That number doesn't fluctuate a ton, as that still represents a percentage of revenue that we can save according to our contract as opposed to the ISF. We're looking at lapsing roughly $6 million according to our interim FSR that we submitted in early November. So that number again fluctuated significantly from year to year based on our CCBHC allocation and some other things. So as you'll see later in here, we've done some things to try to limit that lapse and what we're sending back. But that's what we currently have projected. We won't have a GF lapse this year because we've overspent GF, as we've talked about, with some non-Medicaid CCBHC, the end of the PHE, and some of those other things. CCBHC is one of the highlights. So since we've started that program, as we look at our projected numbers for 24, over the course of the program, looking at about $30 million that we've been able to retain locally as a result of that program. And we were in cohort 1, so kind of on the cutting edge of some of that program. Highlight one of the things in the next section, but we were also one of the first, if not the first, to dive into the DCO pool. And that's been advantageous for us. We've been able to expand our services, help more people, and really leverage that program. So we're really proud of that and that effort in the finance department. It was a heavy lift for us. So skipping ahead to the provider network, as I mentioned before, we pushed roughly $10 million in stability payments out in '24 to support our provider network. This is a legitimate way for us to limit our lapse, increase our rates, and help out providers. So those were items that this board approved. But wanted to highlight some of those dollars here, and then just continuing to look at standardizing our rates, our claims processes, our edits. The state is always changing codes and different things on us. So we're proud of the ongoing efforts we have to keep up with those things and properly manage it. So, Tony.
The next part is around specialized residential services. And just to put things in perspective here, we serve in this area well over 650 of our beneficiaries are in various homes across 50 providers. So it's a very significant part of the work that we do. There was a lot of variation here. Well, let me start with saying the financial challenges that everybody's been facing have, of course, is a big area that the providers that are providing specialized residential services have brought to us on various occasions. So we undertook a process that continues today to revisit our specialized residential and do a few things. One was to look at how our rate structure. We had very disparate rates all across our network. So we looked at how do we create a more person-centered payment structure that really addresses the care that's involved in each of those homes and tying it as close as we can to the individuals. So we went through every one of the individuals, created an assessment process, and then implemented what we're calling a standardized rate model that has levels of modifiers depending on the need. So this was a very large undertaking, but in the end, we have a much better model now that we can ensure that we're aligning, again, the payments that we're making to these providers as closely as we can to the needs of the individuals. And I won't get into all the details of this. Has probably taken us a year to get to this point with a number of folks involved. In the end, I think we've accomplished our goal. The other thing, and part of that, we did a number of program reviews and home visits. We really wanted to understand when providers were telling us about some of their challenges, we went in the homes to go see those firsthand. So we better understand their staffing challenges, the nature of the individuals that they're caring for, and that also helped create a very collaborative environment with our providers, which we're going to continue. And that way, we're working together to solve these challenges. And finally, referrals and placements, as you all know, getting individuals placed appropriately is one of our largest challenges. So a number of the efforts that we have done here, that was one of the ultimate goals, is to make this a better process and a better system so we get people placed where they need to be.
I'm going to cover item number 4. This is one of those that goes back a ways and talk about our finance system upgrades. So that, it's kind of a fluid thing. We're always trying to improve. We implemented Business Central in 10/1 of '21. That was to address standard cost allocation, which was one of the items that the state required us to do. We're also, proud of the fact that we were able to comply with that requirement the first year that it was required. There's others in the state that may not have done that, and the size of our organization, the size of that lift overall, everyone really came as a team effort on that one. So, as part of that, we've been able to digitize. We were pushing out electronic payments. We went from being probably one of the least timely payers from a claims perspective to probably one of the most timely payers from a claims perspective. So we've got the process pretty well mapped for that. Focus integrates with our accounting software, so there's no more manual entry from one to the other. So we're always looking for those type of things that we can do there. So.
Item number 5 is our Medicaid verification audit. That's a required audit that we partner with Jefferson Wells to do that. A couple highlights here. The audit this year included about 34,000 claims, 4.5 million in those claims. We that resulted in about $92,000 in recoveries, or about 2%. But the real important thing there is, through this, is what do we learn that are areas of that our providers are struggling. As you can see, I noted two in our notes here: progress notes missing, and the plan of service not on file, which directly results in recoveries, which of course they don't want. But the important thing here, meeting the requirement, but then how can we help our providers in these areas? So this is where, partnering with the quality department, we can try to get ahead of this, provide education, provide training, and try to reduce those recoveries, because in the end, we want proper documentation and we want those plans of service to be there. So just wanted to highlight the audit, from a requirement perspective, but also from that opportunity to improve how we manage the network.
The number 6 is just, trying to highlight some of the initiatives or things we're looking at in the fiscal 25. We were able to present what we consider a very well put together budget, largely due to Tony and Don's efforts in working on that. To my knowledge, that we haven't heard anything that it made through. So Phil's giving the thumbs up. We continue to look at the Logic Gate system. We've had some discussion here at the board with the approval of those invoices and things. Early January is what we're targeting, and we're making a lot of strides in that effort. But again, it's to that digitization of our functions, and also allowing for more visibility, control, and reporting over those functions. So I think I'm excited about that and what we're doing there. Continuing to minimize our lapse and not have a Medicaid deficit, working with the surplus and CCBHC and how that ties in with our non-Medicaid work. And then there's just, some different things. There was a press release not that long ago about the future, or the new version of the My Health Link program that I think 1126 is what the state has indicated there. So that's kind of on the horizon for us. We don't know what that looks like yet, but it'll certainly have a financial component. And then, as we look into the not so distant future, the minimum wage things that are going on at the state, how does that impact our funding? How does that impact DCW? There's a lot of questions that surround that, and I know Richard is diligently working on advocating for our position, the providers, and certainly the staff, and ultimately the folks we serve, to try to make sure that that's right. So that's all we have. I know that was kind of a breeze through the document, but happy to
Definitely not all we do.
Definitely not all we do. Yeah, there's a ton of accounting minutia and AP approvals and different things that we're doing on a daily basis. But yeah, so questions, comments?
Thank you both. Donna, go ahead.
Really a great report. Thank you so much. Very thorough. I was wondering, I think last month it was, you reported to us that there was some issues with some of the reports you had to do not coordinating with the county. And I'm wondering if those were worked out. And we were having to get some files, and they were already late to the state.
Sure. So I think there's maybe a couple things ongoing there. We have the county, we're obviously part of the county. The single audit report encompasses us. That, to my knowledge, the fiscal 22 single audit has not been finalized, nor has the fiscal 23 single audit. So the state has asked that we submit our 23 compliance exam, which is our audit report specific to CMH, with that single audit. So we've been extended until February of 25 for those two submissions. So we are actively engaged with county finance on updates and things like that. So that's one piece that's out there, and potentially significant if we can't make that deadline. The other thing, and Tony might be able to speak to the details more, I know we have some payroll reconciliation issues that are still ongoing, as we have our UKG system that we needed as part of the standard cost allocation and the Workday implementation. So there's still we have to get the data from the county, reconcile it. So I think we're working on the timeliness of that. And a few other errors that have popped up as a result of that transition is how I would put it. Tony, I don't know if you have anything to add on where we are with the county.
Yeah, just a couple things. I mean, it was a struggle at the beginning, but we've made really good progress. Some of that just required physically going over to county finance and just sitting with them. That was just very productive. So the payroll reconciliation that at one point we reported to this board that we were behind, those have been completed. There's two outstanding things. One is within that, there's still a correction on compensated absences. So we're actively working to correct that, but it's a minor piece of that. The very heavy lift was getting payroll reconciled. The ongoing thing is we need to work with county finance on an ongoing process so that we're not dependent as we are right now to get the information that we need. So that's going to be an ongoing effort and trying to find a way to maybe automate it if we can, or at least have a good process where we get the information timely to avoid any of those backlogs like we experienced this year.
And I can tell you from my perspective, we heard from the county's auditors that it's not us, it's them. So it's not a CMH issue of us getting them the numbers. It's the county's issue of utilizing Workday to use those numbers, because I even asked, is it a problem of our software versus Workday, since they're different programs? And they said, no, ours should be able to be submitted to Workday without an issue. I think it's still the growing pains of the county working through Workday, having our staff familiar with that system and working through those problems. So it's not us, it's them.
Well, just to let you know, they sent out all the retirees are retirement for the year, and then it was wrong, so.
It's the second time I've heard that today.
And of course, sometimes retirees have a hard time with that. So then, within like hours, they had to send out another email that it was wrong. So, you know, they still got bugs.
Right.
And everybody thought it was a scam, and now they're all freaking out, so.
And that's the danger of something like that happening. And so the good thing for us here at CMH is that so far we're doing everything we need to do. We're giving the county everything that is required. And from our end, things are smooth. It's just the acceptance of that and translating it.
Yeah, I think we went from being one of the last departments in that June timeframe, kind of holding up the audit, to where our numbers are done now in that February, March timeframe. And we're just kind of waiting for it to, the county's not due till June, so there's a kind of like a several month lag, but.
So we're working through it still. Are there any other comments or questions for Ken or Tony? Okay, thank you both.
Thanks.
Next, we'll move on to the CEO update with Tracy.
I will be brief, but I do want to just take a second to acknowledge, I greatly appreciate all the staff who are here. So thank you. I just want to make sure, especially during this holiday season, to express my deepest appreciation to Bruce, Angel, Agnes. I'm making sure I'm not forgetting anybody. Christina, TJ, Tema, and of course, the trio of Tony, Richard, and Ken. And last but not least, Matt. We are very privileged to have them, and I'm hoping you're picking up on this. But without prompting, there's always a theme throughout them, which is, what can we do better? How can we make this better for the people we served? How are we managing this? And I just want you to know that that's their innate, right? That is our culture, but I think it's having the right people doing the right thing. So I did send out a board report yesterday. If you didn't see it yesterday afternoon, I do. If you haven't read it, it's really important that you read that, because that allows us to save a ton of time here. And allows us to focus on some really important stuff and not get into the details of the minutia. So if you haven't, please read that. Including, remember, there's headshots coming up. So if you haven't signed up, just know that they already sent me an email showing who's on the bad list. Exactly, so I know who you are. But if I can help, the only downfall is if you don't do it, we're going to use whatever one we have. If you don't like it, that's on you. And then, last but not least, I know we have some very unique challenges. So we're gonna give you some updates on some various things, but again, your starting point should be reading the board report, just so you have a good kind of foundation from there. And I'm happy to answer any questions, but that is all I have to share today.
And if you haven't read the board report and you are going to do so in the future, you can always email Tracy with any questions.
For sure.
All right, we're all set there. We'll move on to a couple reminders. January meetings, program and budget will be here Wednesday, January 8th at 6 p.m. and full board will be here Wednesday, January 22nd at 6 p.m. Are there any other items any board members would like to address? Selena, go ahead.
And then I think it might be through you, but I do want to respond to Nick on 7F. Nobody in this field ever wants to see a hospital lose its licensure. And it's a very tough decision on when that occurs. But we have to do what we have to do to ensure that our folks are getting the best possible care. And I wish Priya Sharma and her family the best of luck to turn around what CMS found in what resulted in this, and that they end up getting approval to become a behavioral health psychiatric hospital. With that being said, is that the health systems have been meeting on a weekly basis in the anticipation of what is that going to look like in our emergency departments for boarding of psychiatric patients, because 100 beds offline at this time of year is a lot of beds. So we've been meeting with the MHA, we've been meeting with the department on what does that look like. We have actually put together a telephone tree where we now communicate better than we ever had among health systems, because there's a lot of us, but we're communicating boarding of anything beyond 72 hours, and we're starting to help facilitate those transfers into a hospital that maybe didn't pick up a referral, or maybe that is not saying that they can, and we're beginning to review. And I think that the only reason I'm mentioning this is because one of the things that we're keeping alert of is our Macomb, I'm looking at our Macomb County folks and where are they getting stuck. Oakland County is getting hard on this because Kingswood, which is Henry Ford, their new hospital got pushed back 30 days on their grand opening. They will not be opening now till January 24th. They have already begun to shut down their unit in anticipation of moving over. Joint Commission did announce that they will need to come back out and resurvey them at their new hospital, which is very different than what they anticipated, only because they're going from 100 beds to 192 beds. And they're expanding children's services, and they're going into what we call intensive care services, and they're also going to move into medical psych, which they've never had before. So they've taken 60 beds down, 100 beds at Pontiac General. Oakland County is feeling the crunch, more so than Macomb County, but myself, which is on the Ascension Legacy, and Henry Ford Legacy, are meeting on a daily basis now, looking at our emergency department, and I'm really focusing. Our report now has the county that the patient reports to, and we're really making sure that we keep a track. If I see that it's becoming a problem, I will definitely reach out to Tracy and say, we have a situation occurring. Right now, we got a handle on it, but January will be a different story. We know January, there's a very large uptick in the requirement for inpatient psychiatric beds because the cold weather sits in, the resources dry up, the transportation isn't there. So I just wanted to let you know that we are working on it. We're keeping an eye on it. I don't see it as great as the Oakland County being hit with that.
Thanks, Selena. Lori, did you?
No, I was just gonna, we will be emailed the calendar for next year with all the meetings so that we can add the dates. Personal calendar.
Yes. It'll be in program and budgets packet.
All right.
But if you want it sooner, I can make that happen. Okay. Any other board members wishing to add anything? Okay. I just want to thank everybody for another eventful year. We've made it through a lot. We have a lot more to go through, which you will find out soon. But to our staff and to everybody we serve, thank you and Merry Christmas, Happy Holidays, Happy New Year. We'll be back here in January. Pedal to the metal. It's gonna be an interesting year. So thank you, everybody. Thank you all for what you do. We greatly appreciate everything. With that, I will move on to provider comments. Any providers wishing to address the board? Any providers? Okay, we'll move on to the second and final hearing of the public. Anybody from the public wishing to speak? Anybody from the public? Okay, hearing and seeing none, we will close the hearing of the public and we will move into closed session. I will take a motion to go into closed session to discuss attorney-client privilege memo dated 12/18/24. Motion from Donna, support from Megan, and I need a roll call vote, so I will call you each individually. Mark. Donna. Lori. Selena. Megan. Myself, yes. Dana? Nick?
Yes.
Wayne? Yep. All right, we will be going into closed session. Everybody who's not invited into closed session may leave the room, please, and have a good holiday.
Have a good holiday.
Tony, Richard, Ken, Drew, you stay.
I'm good. How about you? Yeah, very good.
Hi, how are you?
I'm good. How are you?
Good. So we're scheduled for like the
Second
January.
CIT?
Yes,
Yeah.
24 people, 21 to 24 will be
Good.
coming.
Good. All right. I feel like so far. We're gonna stay away from you finance people. No, not intentional. Yeah, I'll get up and stretch. Do we want to sit up here? It's a lot of people.
You're looking better. You're looking pretty rough from what I saw.
Is this good?
Looks like you brought his bowling ball bag.
I don't know what to do.
We're gonna try to keep this as brief as possible. Somebody please let Sandy back in.
Look, we're knocking people out.
I invited her to stay and she decided to leave. This would be the time. You may wait, yeah.
I know all has been assigned to us.
That's the glass reminder crowd out there.
Okay, just one. Everybody filing in? Come on in, everybody.
I'm hoping
All right, we are back in open session. I will take a motion to approve the contract with Easter Seals dated October 1st through December 31st. Motion from Selena, support from Dana. Comments, questions, discussions? Hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. I will take a motion to adjourn. Motion from Megan, support from Dana, all in favor? Aye. We are all adjourned.